Hello everyone. This class we are going to talk about mastitis. Mastitis, as we know, it is one of the most important concern when it comes to dairy farming, the dairy sector, as well as the credibility of a veterinarian a clinical veterinary practitioner is often considered. So mastitis is a major problem in the Indian dairy sector. Not only in the Indian dairy sector, it's a major concern all over the world, and there are many public health and industrial concerns associated with mastitis. And even though the term mastitis in veterinary parlance means it could be the inflammation of the mammary system of any animal, because of the economics involved, the large number of cases involved, mastitis usually refers to bovine mastitis. As a part of your veterinary curriculum, you are supposed to learn about mastitis of all the major farm animals, and we will be covering about those other animals also, but our major concern will be mastitis in dairy cows. So in this class we will be discussing on some basic concepts regarding bovine mastitis, and in next class we will be talking about the diagnosis and hopefully treatment of bovine mastitis. So what is mastitis? Mastitis can be defined as the inflammation of the udder parenchyma that results in the physical and chemical change in milk. So there will be inflammation, there will be signs of inflammation, there will be physical and chemical changes in milk that will be visible. However, this is not the case in most of the conditions. Inflammation may not result in any visible changes in many cases. So it is very difficult to appreciate bovine mastitis clinically, and many a times mastitis may be involved with a transient reduction or a subtle reduction in milk production and an associated increase in the count of the somatic cells present in the milk. Hence, there may be certain indirect tests needed for diagnosing mastitis in dairy animals. So, that is the definition and the premises on which we will talk about bovine mastitis. Now, how can we classify mastitis? We know that a large number of organisms is known to cause mastitis. At least 140 of them are commonly isolated from mastitis cases, and mostly they are bacterial in nature, even though fungal or viral organisms can also cause mastitis, but those conditions are very rare. But based on the pathophysiology and epidemiology, bovine mastitis is mainly classified into three groups based on the epidemiological and pathophysiological nature. So they are environmental mastitis, contagious mastitis, and mastitis caused by teat skin opportunists. So what is environmental mastitis? Environmental mastitis means the mastitis that animal acquires from the environment. So this can be because of inadequate management of surroundings, resulting in an increased load of bacterial organisms in the immediate vicinity of the cow, and can be due to wet bedding, inadequate pre-milking preparations, fly bite rarely, occasionally teat injuries, and improper care during dry period and early lactation. So there is a lot of management and environmental hygiene involved for the precipitation of environmental mastitis. And what are the organisms that causes environmental mastitis? It can be coliforms, can be environmental streptococci, and occasionally another bacteria called Truparella pyogenes. So coliform mastitis is a very familiar term to you, and we know that coliform mastitis results in severe cases of mastitis. However, coliform mastitis do not form chronic infections. So the episode comes as an acute mastitis, and maybe it can have a deleterious result, or depending upon the treatment the animal may recover. However, it will not form itself into a chronic case of mastitis. Then another important organism that cause environmental mastitis is environmental streptococci, like Streptococcus uberis and Streptococcus dysgalactiae, and they are known to cause mild to moderate infection and occasionally can cause subclinical mastitis also. Truparella pyogenes is a peculiar bacterial organism that is notorious in causing mastitis among heifers, and that too in the stages of late pregnancy. That will result in a severe a purulent infection of the udder, and usually the udder is lost. So that is environmental mastitis. Then we have contagious mastitis. So in cases of contagious mastitis, the spread of infection is not from the environment to the animal, but from cow to cow. So here cow to cow transmission is a common feature when it comes to contagious mastitis. It can be through the washcloth, the cloth that is used to commonly being used for washing animals, common teat cups, or certain faulty equipments that will during milking that can cause flow back of milk from the teat cup to back to the teat or the udder. So here there is a cow to cow transmission, and the transmission can be easily disrupted by maintaining the hygiene in the farm, and also we can take conscious steps to disrupting this cow to cow transmission. So that can be through treatment, can be through culling, there can be a lot of control measures that can be put into practice. But since contagious mastitis can be transmitted only from one animal to other, not from there is any environmental risk involved, it is relatively easy to control. And what are the organisms that causes contagious mastitis? Usually it is Staphylococcus aureus, and it is a notorious organism, being very difficult to control. But the certain organisms like Streptococcus agalactiae that causes contagious mastitis are rather easy to control. Mycoplasma bovis is another organism that spreads from cow to cow, but it is an uncommon pathogen. The third group, or the third class in this system of classification, are mastitis that is caused by teat skin opportunists. So these organisms may be normally present on the surface of the udder, and whenever it gets an opportunity by to access into the udder through the teat, or if the immunity of the udder is in an imbalance, these organisms can cause mastitis in the animals. So usually such organisms belong to a group of staphylococci called as coagulase negative staphylococci. That means these organisms can be easily distinguished from other organisms like Staphylococcus aureus, other staphylococci like Staphylococcus aureus, based on a test called as coagulase test, wherein these organisms fail to coagulase rabbit plasma. So it is because of presence or absence of certain virulence factors. We will be talking about these things in details. So this is how we classify bovine mastitis, and this is there are many forms of mastitis. We classify mastitis as acute, subacute, chronic, clinical, subclinical. So there are many ways to classify, but the system of classification acquires more meaningful and it is more useful when we classify based on the pathophysiology and epidemiology of occurrence. Now, as I told, there are about 150 or more types of organisms that cause bovine mastitis, and that can be again classified based on the mode of spread as environmental, contagious, and teat skin opportunists. Then they can be also classified based on their ability to cause clinical mastitis. So those are able to cause clinical mastitis are called as major pathogens. and those are not and those that are not able to cause clinical mastitis are known as minor pathogens. Then based on the prevalence of pathogen, it can vary from country to country, because the we cannot say that it is always or usually this particular organism globally, but it can vary from country to country depending upon the method of rearing, depending upon the mode of spread, depending upon the standards of hygiene in a farm. So it can vary from country to country. But however, identification of the common pathogens that cause bovine mastitis will help in understanding how the disease is spreading, maybe within the herd or within a state or even within the country, and appropriate control measures can be taken up. Now let us see what are the common organisms or the peculiarities of the organisms that cause environmental mastitis. So environmental mastitis is usually caused by, one is coliform, which is the commonest organism that causes environmental mastitis. Then we have environmental streptococci, that are Streptococcus uberis and Dysgalaxiae. Then teeth skin opportunists, usually coagulase negative staphylococci, and contagious pathogens, Staphylococcus aureus, which can cause both clinical as well as subclinical mastitis. Then Streptococcus agalactiae. So those are the major etiologies that cause bovine mastitis. Now, so what are the source of infection for these different types of pathogens? So as I told, the environmental pathogen, usually the source is the immediate vicinity of the animal, can be the dung, it can be the wet bedding. So and this type of mastitis, since it will depend upon the load of the environment and microbe in the environment, it can happen at any time when the presence of the environmental load is very high, as well as if there is any imbalance in the immunity of the udder of the animal. Whereas in contagious mastitis, it is usually the source is always the infected udder, and this risk of exposure is limited only during the milking process. So cow to cow transmission of contagious mastitis is possible only during the milking process. It's limited to the milking process. Similarly, opportunist pathogens, it is always in the teat skin, and again it is limited to milking, where the teat sphincters open for letting down of milk, and if there is a flow back of milk, or if the sphincter is open for a long period, then these opportunistic pathogens are able to gain access into the udder. Now coming to the transmission, so environmental pathogens directly move from the environment to the udder, and contagious pathogen, it is always associated with the milker or milking equipments, because the exposure, risk of exposure is always limited to the milking period. Now what are the risk factors involved in mastitis? So as in case of any disease, there is an epidemiologic triad that includes the host, the environment, and the agent. So what are the host risk factors? Yes, there are a large factors, because there has been a lot of studies on various risk factors of bovine mastitis, and these have been documented also. So the knowledge regarding epidemiology of bovine mastitis is very vast. So it is already known that as the age of the animal increases, the risk of occurrence of mastitis will also increase. Similarly, stage of lactation. So the early dry period and first 2 months of lactation is known to be the highest or the riskiest period for occurrence of mastitis, and for heifers, the last trimester of pregnancy is a high risk period. Then coming to the season, so when it comes to tropics or subtropics, like in our place, the factors that come into play are winter, high humidity, and calving season. So whenever in case of winter or in cold climates with a high humidity, there is an increased risk of mastitis, especially during the monsoon period in our place. and if there is a seasonality of calving, as in case of subtropic areas, so the calving season there will be a lot of environmental contaminants, and that can cause increased mastitis during that season. Whereas in temperate regions, the summer, because of this higher ambient temperature, which will be more favorable for the bacterial pathogens to multiply and can poses an increased risk of occurrence of mastitis in temperate regions. Somatic cell count is another important factor. So you know that somatic cell count means the cellular components that are present in milk. Usually it will have the macrophages, neutrophils, and few epithelial cells present in the udder. So somatic cell count indicates the level of immunity, or the state of immunity of the udder, or the state of immune response of the udder, and lower the somatic cell count, there is an increased risk of environmental mastitis, and higher the somatic cell count, there will be that indicates presence of subclinical mastitis. Teeth morphology is another interesting risk factor, because it has been studied heavily, and the teeth morphology, or when the teeth canal diameter is large, or if the rate of milking is large, or if there are any teeth lesions, or in case of animals with udder edema, there is a higher risk for the occurrence of mastitis. Another important feature or trait that has been studied is the distance between the teeth end and the floor. So this teeth end to floor distance, as you know, if the distance is very low, that means the low hanging udder then is there. That means there is an increased risk of contact with the floor of the animal, and if this distance is low, that means there is an increased chance for occurrence of mastitis. And peculiar and interestingly, it is a moderately heritable genetic trait. So the practical utility of this knowledge is that whenever you are selecting a cow, you should see how low the udder is hanging, and if the udder is very pendulous, or the teeth is very low hanging teeth, or the distance is very low, then you should understand that there is a risk of increased or there is an increased risk for mastitis. So that is regarding the teeth morphology. Then condition of the teeth. So teeth, as you know, it is the first barrier against the infection, and teeth thickness, increased teeth thickness and increased teeth end thickness are high risk for mastitis. So the hyperkeratosis of the teeth orifice, or the teeth end callosity, the callosity in the teeth's end increases with the lactation of animal, and as the lactation increases because of the frequent milking out, there will be an increased keratosis in the teeth orifice, and as this keratosis or hyperkeratosis occurs or the callosity occurs, there is an increased chance for these teeth skin opportunists and other pathogens to enter through the teeth orifice, and that poses an increased risk of mastitis in such animals. Then udder hygiene. So there is nothing to explain. So increased udder hygiene means there will be an increased bacterial load, and that can cause an increased risk of environmental mastitis. Nutrition plays a very important role, because the level of vitamin A, vitamin E and selenium in the diet of animal is known to confer an increased immunity to the udder. So if the plane of nutrition, or the availability of especially vitamin E and selenium is below par, then there is an increased risk of mastitis. Then coming to udder immunity, when coming to udder immunity, so udder has its own defense mechanism, like the teeth plug, the keratinization during the teeth canal, keratinization of the teeth canal during the dry period, that is known as the teeth plug. Then the level of the immunoglobulin that is being distributed during the dry period and during the waxing of udder, then there will be immunoglobulins in the udder parenchyma during dry period, and then what happens is that as the udder waxes during the later stages of pregnancy, this immunoglobulin gets diluted off because of the increased volume of milk being produced. So large volume of milk will start to pool in the udder, that will cause the lowering of the humoral immune mechanisms present in the udder, and thus the later dry period and the first 2 months of lactation poses a very serious challenge to the udder with respect to the immunity. So this derangement during the late dry period and early lactation can result in an increased susceptibility to mastitis. When it comes to the previous occurrence or the history of mastitis of an animal, so once an animal is infected, then there is always a risk for subsequent infection. So it is very important for a dairy farmer to keep in mind of this fact, because once his animal is infected with mastitis, then subsequent lactations also there is a risk for infection. So utmost care of the udder is very important when it comes to dairy farming. Okay, now coming to the environmental or managemental risk factors. So it is housing. As you know that housing means it can be the flooring. So floor is always an important source of contaminant. So wet bedding and unhygienic puddling of water in the floor, all these improper or the damaged floor that causes that can harbor more number of organisms will result in the total environmental load of the bacteria. Then high humidity and ambient temperature, high ambient temperature favor bacterial multiplication. And quality of housing, of course the house should be dry and clean, and overcrowding, poor ventilation, all these factors contribute to the total environmental bacterial load, as well as overcrowding can also increase chance of cow to cow transmission also. So all these factors will contribute to the increased risk for mastitis. And what about the size of the herd? When the size of the herd increases, then there is increased chance for cow to cow transmission also, because of the large number. There will be we will have the farmer or the milkman will try to compromise with the hygienic or pre-milking preparations that can result in cow to cow transmission. Then milking practice, of course, the high risk factors include milking with a wet teeth. So ideally you should not wet the teeth during milking. So milking should be performed on a dry teeth. Then presence of personals has been known to increase the occurrence of mastitis or increase the somatic cell count. So machine milking is always preferred, and nowadays in highly advanced countries they do robotic milking, because in order to avoid the risk of increased somatic cell count due to presence of personals. Then you should not use common towels as far as possible in a dairy farm. So common towel means the same towel when it is used for wiping the udder of more than one animal. Naturally you are transmitting the organism from one cow to another. Similarly, you should not use same teeth dip equipment for multiple animals. And inadequate dry period, so you have to give at least 2 months of dry period for animals, at least 2 months. And then inadequate dry period can result in an increased occurrence of mastitis in a farm. Then establishment of quality regulations. So there should be some quality regulations when it comes to milk production. If you don't set any standards in your farm, that means nothing is being monitored. Whatever thing is being monitored can only be assessed, and this assessment will help in improving the standards. So if you don't have any quality standards, suppose you don't regularly monitor the somatic cell count in a farm, you will not know what is the standard or what is the quality, and you will know the conditions have gone out of your hand until only when you find a large number of clinical mastitis cases. So if you have a set quality standards, you will be generally regularly monitoring, and whenever you see the variations, then you will put in some additional control factors or control measures, or you will audit regarding what is the problem when that is causing the increase in cell counts, and thus you will take measures to reduce. So wherever in or whichever farm that has this quality monitoring and set standards, those farms are generally free from or have a reduced incidence of mastitis. Then what are the pathogen risk factors? It is about the viability and the virulence of the organisms. So viability means the ability of the organism to survive in the environment. Environment can be the environment of the animal or the environment of the pathogen. Organisms like E. coli survive well in the dung, and that is why these coliforms occur as an environment mastitis, whereas organisms like Staphylococcus aureus have inherent ability to survive within the udder of the organism, and thereby transmitting from cow to cow during milking. Then virulence factors are another important pathogen risk factors. So depending upon the sets of virulence factors present on a bacteria, it will result in the outcome of infection. So virulence factors can be either toxins or the factors that help in colonizing the bacteria inside the udder. So whenever these organisms have toxins like in E. coli, so virulence factors are mainly toxin. That means the infected animal will become or show signs of toxemia, and the entire system of the animal will be affected, and it can cause a severe infection or severe illness in the animal. Whereas in certain organisms like Staphylococcus aureus and all, it is about the most of the virulence factors that these organisms possess are those which help in colonizing the organism within the udder of the animal, and thus these organisms won't be producing a large number of toxins, but can persist in the udder for a very long time. So those are the pathogen risk factors. Now, what about the genetic component of the animal? So is mastitis and the genetics of animal are related? There is a very low heritability, because there are many factors come into play in the occurrence. It's not just about the immunity of the animal or the immunity of udder as such, but many other factors like the hygiene, the environmental factors, the pathogen risk factors, as we have seen, can also contribute. But certain inherited traits like the conformation of the udder, the depth of the udder, as we told, the distance between the floor and the teeth tip, the teeth length, the shape of the teeth, these can play a certain role in susceptibility or resistance to mastitis. Similarly, the chemical quality of milk, the level of lysozyme present in the udder, the other defense mechanisms like lactoferrin, lactoferrin peroxidase systems, that the level of lactoferrin present in the milk, and these factors can help in the prevention or help in fighting mastitis within the animal. Then similarly, the ability to form the keratinization of the teeth plug during dry period, or the teeth canal during dry period. So these factors are moderately inherited genetically, whereas since we have a large number of environmental factors that come into play when for the occurrence or precipitation of mastitis, we can generally say that the resistance to mastitis is genetically, it has a very low heritability. What are the economic impacts of mastitis? We know that mastitis results in huge production loss that is often sensed by the owner. You have to discard the milk from the udder, as well as the recovered animals that are clinically recovered but are still under treatment. Sometimes you may have to cull the animal, then you will have the replacement cost. So you have to loss of the cull animal as well as the cost for replacing the culled animal, veterinarian's charges. Then in certain cases of mastitis, there is a risk of abortion during the first trimester. then there can be reduction in consumption, because it is seen that the consumption rate decreases during, if there is mastitis during the first week before or 2 weeks after artificial insemination. Then there is cost for implementing additional control measures inside the farm. Then your farm will be producing a poor quality milk once it has a increased cases of mastitis. So there will be of course there will be antimicrobial issues of antimicrobial residues, there will be increased somatic cell count, pH, etc., that will further render the milk unstable for further processing like cheese making or ice cream making or other making of products. So the quality of milk lowers, so you will not be getting the amount that you the profit that you used to get. Then if you have to, if your highly producing cow becomes infected and you are to cull the animal, then that is another loss from that side, is because the genetic potential of that particular cow becomes untapped, and that can cause a long term but much less sensed loss in the farm. Then there is of course a constant loss because of the occurrence of subclinical mastitis. So whenever the udder has, or an animal is suffering from subclinical mastitis, there will be at least 10 to 20% loss, and 20% of there is a economic it is seen that whenever the cases of subclinical mastitis is lower, then the production or the economics advantage, there is at least 20% economic advantage in herds that have a lower prevalence of mastitis. And not only that, not only the bulk of the milk, the volume of milk increases, but also the total solids, fat, etc. of the milk also increases whenever the farm has a lower prevalence of subclinical mastitis. Then, is there a zoonotic potential? Is there a zoonotic angle for bovine mastitis? Of course, there is a zoonotic angle, because consumption of infected milk or poor quality milk can result in food poisoning. Then there is a risk of certain zoonotic diseases like tuberculosis. Tuberculosis mastitis can happen. Listeriosis can happen through consumption of infected milk. So is brucellosis. So that is regarding some basic concepts of bovine mastitis. And now let us see the pathogenesis in detail. You may think that there is nothing to be there for pathogenesis when it comes to mastitis. The udder bacteria goes into the udder, multiplies in the udder, and that will cause damage to milk and cause mastitis. But it is not so. There has been studies, and it has been established that there is a mastitis occurs through a 3-stage process. So the first is invasion, followed by an infection, then only inflammation happens. And in many cases, invasion may not result in inflammation also. So what is invasion? Invasion means the entry of the organism from teeth into the teeth canal. This is followed by infection, wherein the bacteria, using milk as a medium for growth, multiplies uncontrollably and invades into the mammary tissue, and there will be multiplication of organisms and extensions into the tissue and production of toxins in some cases. Whenever there is an excess toxin production, there may not be any inflammation. Before that, there will be systemic signs without inflammatory changes. This is followed by a stage of inflammation, where there will be appreciable changes in the udder as well as in the milk. There will be changes in the somatic cell count and the changes in the type of somatic cell count. So a normal milk will have like 66 to 88% of macrophages, then some 10 to 11% of neutrophils, then 10 to 27% lymphocyte, and probably maximum of 7% epithelial cells. Probably 7% of maximum of 7% epithelial cells. But when it comes to mastitis, the neutrophil percent shifts from this 11% to at least 90%. So there will be a shift in the number as well as distribution of somatic cell count. during mastitis. Then the inflammatory response. What is the response to this inflammation? There will be infiltration, rapid infiltration of neutrophils. Then this rapid infiltration will cause or these neutrophils act as macrophages and engulf the bacteria that are present on the milk. And if the primary infiltration is able to contain the infection, the somatic cell count will return to the normal values, and that will cure the disease. Now, what happens if this primary infiltration is not able to control? Then there will be more migration. There will be an increased migration of neutrophils between the secretory epithelium, and this excess diapedesis can cause damage to the secretory epithelium, and thus the milk production decreases. Then that will also result in an increased somatic cell count, and that is appreciated as a clinical or subclinical mastitis. So of course there will be an effect on the milk yield. Milk yield will reduce in case of mastitis, and that will depend upon the organism that has invaded. So coliforms, it is known to cause severe mastitis, and there will be a sharp reduction in the milk production. Staphylococcus aureus can cause moderate reduction of milk yield, but the infection will persist for multiple lactations. Then Tuberculopyogenes, it will cause a purulent unresponsive mastitis, and the udder is usually lost. Mycoplasma bovis, it's an uncommon pathogen, but it can cause chronic induration, total loss of the udder without a possibility of recovery. Then the loss of milk yield can also depend upon the stage of lactation also. So in early lactation there is an increased loss and long-term effects when it comes to milk yield. So mastitis that occurs during the late stage of later dry period and early stage of lactation can be very detrimental to the farmer. Then of course the result of treatment can also plays an important role. So the treatment should be constituted as early as possible using the appropriate drugs. So that is regarding the pathogenesis of mastitis. Now what are the clinical findings of mastitis? So that varies between the etiologies, and in case of clinical mastitis can be detected by examination alone. So there will be changes in the milk, and how will you know if a mastitis is clinical? You examine the udder, you will find the cardinal signs of inflammation, you will find ruber-callar tumor dolor. Then there will be change in the udder also. Then there will be change in the milk also. Usually a case of clinical mastitis can be confirmed by getting a negative response to a question that you ask to yourself. You look at the milk from the cow and ask yourself, would you drink this milk? If your answer is no, then the animal is having clinical mastitis. Then clinical findings can be classified based on the level of involvement, based on the severity as acute, peracute or subacute, and the duration of infection like a short-term, recurrent or persistent form of mastitis. But the most sensible and the most practical way that help in the diagnosis, treatment and preventive aspect of mastitis is to classify the clinical sign based on. So whenever you get a case of mastitis, you classify the clinical sign based on the level of involvement of the animal. So see if the milk alone is infected, that is milk alone has changed, that is abnormal secretion. If there is a involvement of the udder like fibrosis, edema or something like that, then the udder is also involved. And third is the abnormal cow. So a 3-compartment view. So milk, abnormal secretion, abnormal udder and abnormal cow. Let us see what are they. What are those? So abnormal secretion means you do a strip cup test. You draw your milk onto a very black surface like should be a a shiny black surface. Then you will be able to appreciate the clots, wateriness, flakes and all, and that can show that the milk is, so the udder may be normal, but milk alone is affected. So there is abnormal secretion. So wateriness is another feature. So you may be able to appreciate clots and wateriness. So wateriness indicates chronic mastitis, and this can be a concern when this wateriness is persistent for at least 2 or 3 or more streams of milk. Otherwise it is okay. Then flakes at the end of milking can indicate tuberculosis. Then incomplete milking between 2 quarters, mixing of milk. So that means while doing a strip cup test, so that means while doing a strip cup test, you will be drawing milk on the receptacle and seeing, so you did not find any problem. Then there will be some milk remaining in the receptacle. Then you draw milk from the next quarter into the same receptacle, and if you are seeing that these two milk are not mixing properly, that means there is a risk of infection, or there is a possibility of infection in one of these 2 quarters. Usually if there is no infection, then the mixing, or you won't be able to see the new stream of milk, but rather it will mix with the old stream that you have collected readily. If there is no proper mixing, then that indicates a chance of infection in one of the 2 quarters that you are examining. Okay, now when it comes to the abnormal udder, you have to examine the animal before and after milking. You have to examine the udder before and after milking, and ideal way is to observe from the behind of the animal, and you have to examine for the symmetry. Okay, so you have to examine the symmetry of the udder. That will give an idea if there is edema or atrophy in any one of the udders. If it is so, then there won't be any symmetry. Ideally the udder should be symmetrical when you examine from behind. Then palpation is done to estimate the edema, fibrosis, tubercles, atrophy, etc. Udder should be normally warm. The increased warmth indicates of course a sign of inflammation. Then you have to examine for the presence of lesions on the teeth, and enlarged supramammary lymph node also points to a abnormal udder. Okay, then there is the compartment, third compartment, that is the abnormal cow. This occurs when there is a systemic response and there is infection with a toxin producing strain of bacteria. Now there can be pyrexia, tachycardia, ruminal hypomotility, depression, recumbency, etc. Then if there is pain and severe form of severe edema or inflammation, then the hock to hock stance will be there. The animal will be extending its or standing with the hindquarters widened stance will be there. Then if the systemic involvement is there, the feeding will be reduced. The animal will be feeding slowly than normal, and it will spend more time standing rather than lying down. So that is how you judge an abnormal cow. So clinical findings, when you say about clinical findings can be at 3 levels. So it can be either an abnormal milk or abnormal secretion, abnormal udder, or abnormal animal. So based on this you can see how far or what type of organism is involved, and that will help in further treatment of the animal when it comes to bovine mastitis. So those are clinical findings, and in next class we will see how we can diagnose bovine mastitis. Diagnosis of bovine mastitis, when it comes to clinical, as you have now seen, diagnosis of clinical mastitis is not a very important task, but when it comes to subclinical mastitis, you will have to diagnose, and it as you have learned today, subclinical mastitis is a very important aspect of bovine mastitis, as the farmer can experience loss from at least 10 to 20% of milk from the quarter, as well as a 20% disadvantage from another farm that has a lower level of subclinical mastitis. So we will talk about the diagnosis of mastitis in detail in the next class. Thank you.